Hi everyone, it's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you again about another topic. Today I want to talk to you about post-stroke depression and post-stroke PTSD, or post-traumatic stress syndrome, or disorder, I should say. Now, 30% of stroke patients develop depression after it occurs. So I want you to just realize that, because I see a lot of patients come in with family who like to negate this or um, refute it and do a lot of encouragement with negative reinforcement, and it kind of makes the patient feel bad about feeling depressed. But depression can inhibit you from moving forward after your recovery. So it's very important that if someone is experiencing this, that they get treatment and they're not discouraged or dissuaded from taking their medications, and that you actually encourage them to. It doesn't mean they have to be on it permanently, but it is a common symptom after a stroke. So please do not be a discouragement in this area or make them feel bad about how they're feeling. Positive encouragement and reinforcement is always preferred. Okay, so let me start with that. Now, what is post traumatic stress disorder? So, a simple way to put this is a severe anxiety that's brought on by triggers from a traumatic event. So, people who've had a stroke might avoid going places where the stroke occurred or activities that they were doing while the stroke happened. Um, and this is relevant not just to stroke patients, but brain injury or anyone who's experienced any sudden change in their quality of life due to an event like a heart attack or an aneurysm rupture or brain hemorrhage. So this is relevant to those patients as well. Now, what to do about this? First, let me tell you some common symptoms so that you can identify it when it is in your presence. So, some common symptoms of depression include lack of interest or pleasure in doing things, feeling down, depressed, hopeless, not being able to control worrying or stop worrying, feeling anxious, on edge, nervous, suicidal ideation, thoughts of wishing you were dead or killing yourself, as well as decreased appetite or overeating. There are some other symptoms. I'm not going to go through all of them, but those are things you can look out for. And I just want to give the caregivers and patients some solutions and options to help. So maybe you're a person who's 6 months or more post stroke. You've been cleared to go back to work or resume regular activity, and you're finding that it's more difficult than you thought it would be. And I just want to remind you that you have overcome something major, and sometimes you just need to remember what you've gone through and how far you've come. And we easily forget that in life, no matter who we are. But use that as a motivator to get you moving again. So rather than the lies of telling yourself that you're washed up and you're not good enough and I can't do this, you might have applied for a job after this happened and you didn't get it. Keep trying. Don't give up. I want to leave you with a quote from Pat Riley, who's a basketball coach, that says, "Anytime you stop striving to be better, you're bound to become worse." So don't stop striving. You will have a high potential of getting worse if you just throw in the towel. And this is something caregivers can use as encouragement to remind these folks that they still have potential to be a contributing member to society and get out there and do things. If they can't get back in the field that they used to work in, there are alternatives. We're not one-trick ponies. We're made with many gifts and talents, and what we did before is not all we can do. So branch out, pivot to something different so that you can still serve and earn an income that can help you feel more independent and boost your morale. Now, the next thing I want to say is request a functional capacity evaluation from your doctor. A functional capacity evaluation is an official evaluation that will test you in different areas to see what your capacity is. And this can actually be a good indicator of the types of activities or work that you can get back to. So it can give you some direction on maybe what things to apply for and what you can do. And also, if you're a professional who may find it difficult to get back into your field, just want to encourage you to work with the institution, whether it's a school or a hospital, to let them know what happened and tell them that you're interested in getting back to work, because there are remediation programs available even at schools or in the workplace, where they will link you with someone who kind of serves as a supervisor or a mentor to help you as you gradually progress to get back into the field. And you might start off by working 4 hours instead of 8-hour work days, because it's more difficult to work at the same capacity after something like this happens. So you don't want to go right back into it full force, but see if they can accommodate maybe your part-time schedule and gradually let you increase your hours and your load as you are able. So it's called a functional capacity evaluation, and you want to ask your doctor for a referral. And these programs exist. They're few and far in between in some places, but if you ask, I'm sure they can try to help you find one where you can go. The next thing I want to encourage you to do is apply for jobs. So apply for something. Like I said, it doesn't have to be what you're doing before, but it's really important when we feel like we're contributing to society and using our abilities to do something meaningful. And this actually will help motivate you to continue your recovery rather than go backwards. The fourth thing is resume therapy. A lot of times once people leave the hospital setting or transition to outpatient therapy and have exhausted their therapy, they don't do their home therapy program, and all the exercises and strategies that they learned to help them in the recovery process are dropped, and they end up losing the gains that they made and get deconditioned. And this is another problem. So resume your therapy. And if you're unable to get back into therapy, you might have worksheets that you saved or some recollection of what you did, or the caregiver might know the things that you were working on. Get back into your therapy so that you can maintain what you have gained. Okay? Don't give up. You can do this. Remember who you really are, and don't listen to the lies that because this happened to you, you are no good. You still have a purpose. You survived it. You're a champion, you're an overcomer, and you're determined, and you can do anything you put your mind to. So tell yourself those things when your mind tries to tell you you're defeated and you can't do it, okay? And caregivers, encourage them with these words, okay? They are overcomers. Remind them of this, because it is easy to forget, okay? And I'm trying to remember if there was something else I wanted to tell you. Anyway, I'll put it in the video notes when it comes back to me. But if you're a person who is suffering with severe debility, limited by pain, trauma, disability, or chronic illness, and would like to work with a physician who can help give you an individualized treatment plan to help you achieve increased independence, function, mobility, and quality of life, I invite you to book an appointment at Freedom Wellness Physiatry. And you can also subscribe so that you can get more info and updates along the way. I look forward to seeing you, and I'll talk to you next time. Bye-bye.